Good afternoon, and thank you to everyone who's joined us here today. As you might be aware, a growing number of people in our community are coming down with COVID-19, the flu, and RSV. We see it in our homes, our workplaces, and in our schools and daycares. I see it in my medical practice, and our hospitals are seeing it as well, as more and more patients are being admitted for serious respiratory illnesses. This is putting a strain on our healthcare system and all of my colleagues who work for our healthcare systems. My colleagues on this call will provide more details and data in just a moment. But as Commissioner of Public Health, I want to remind everyone how important it is for our entire community to step up and help slow the rapid spread of these viruses, which for some can be serious. But even if you are not worried about getting sick yourself, you or a loved one may unexpectedly need emergency care for a life-threatening condition and face a long wait in an overcrowded emergency department. Your child may need to see a pediatrician, and you may not be able to get that appointment as quickly as you would like. And all of this is because our healthcare workers are getting stretched more and more by the increase in respiratory illnesses, many of which can be prevented. These are the types of scenarios that we are trying to avoid, and we all can avoid them. We know the drill. The most important steps that you can take are, number one, to get vaccinated now. It is not too late to start building up immunity as we head into the holidays and the height of the respiratory virus season. Talk to your healthcare provider or pharmacist to determine what vaccines are appropriate for you. Number two, if you are sick, please do whatever you can to avoid sharing your illness with others. Stay home as much as possible during your illness and for at least 24 hours after your fever goes away without medication. And third, and finally, a word about masks. They do work, but only if they are chosen and worn properly. If you wear a mask, ideally find a snug-fitting KN95 or N95 mask and make sure it covers both your nose and your mouth. This will help protect you from getting sick and prevent you from spreading germs if you are sick. The CDC recommends that anyone who is at high risk for serious illness from COVID-19 or the other respiratory viruses wear a mask in indoor public places at this time. And of course, anybody who chooses to do so is welcome to wear a mask as well. And four, have a plan in case you do get sick. If your condition is not life-threatening, what would you do in order to avoid an unnecessary visit to our overburdened emergency department? My colleagues here will help provide some options for you. We all want to be healthy for our holiday gatherings, so let's do what we can right now to stop the rapid spread of COVID, flu, and RSV in Monroe County. So next, let me introduce my colleagues who will each make a few brief comments in this order. First, Dr. Linda Clark, our new president and CEO at Jordan Health Center. Dr. Michael Apostolakis, Chief Medical Officer at UR Medicine. Dr. Robert Mayo, Chief Medical Officer at Rochester Regional Health. And Ms. Jackie Dozier, Director of Community Health and Wellbeing at Common Ground Health. Dr. Clark.
Thank you. Good afternoon. I would like to thank Dr. Mendoza and the Monroe County Department of Public Health for their continued efforts in raising awareness about the increased cases of COVID, flu, and RSV. Over the last several weeks, we have seen many throughout our region and some in the most vulnerable communities battle these illnesses. We know that COVID, flu, and RSV can affect each of us differently based on many factors. While the effect can be different for all of us, this latest increase in new cases directly impacts all of us throughout the community. It impacts our schools and what our children may come in contact with, our co-workers who may need to be out of the office, as well as our families who are caring for us. This latest increase in cases comes as no surprise, especially after the Thanksgiving holiday, which is why we need to continue to talk about these issues and raise awareness. As already mentioned, it's very important that you get your vaccinations, your yearly vaccinations. But honestly, there's still many in our community who are not vaccinated, which is why it is even more critical this time of year to remember our safety precautions. We wear our masks, especially if you feel ill, and keeping your hands washed. We all know this sounds very simple, but it's more challenging as more of us plan to get together over the next several weeks for a holiday. You know, there are concerts, winter activities, and celebrations with friends and loved ones. But please remember, COVID, flu, and RSV are easily spread. We understand that children may forget to wash their hands or wear a mask if they're feeling ill, which is why all of us, especially the adults, need to ensure we are doing what we can during this holiday season to minimize the chance of spreading these illnesses. It's also equally important for us to remember what we should do when if we begin to feel ill, like wearing our masks. At Jordan, we're back in masks for our patients and our staff. Stay home if you're sick, wash your hands, and contact your provider. Calling your doctor's office could save you a trip to the emergency room and eliminate wait times. Your provider also knows your health history and will be able to provide proper guidance. It's important for us, especially now, to all work together to protect ourselves, our families, and our community. Dr. Apostolakis.
Thank you, Dr. Clark. I'd like to thank the Monroe County Department of Health and Dr. Mendoza as well for setting this up, and for obviously my colleagues and for the media to be here and help spread the important message that we're giving today. In October, we had a news conference encouraging the community to protect themselves against flu, COVID, and RSV by getting vaccinated. Today, we want you to know that the cases of all three respiratory illnesses are rapidly rising and stressing the capacity of our healthcare systems. At Strong Memorial, the number of hospitalized patients on isolation for respiratory illness has more than doubled since Thanksgiving. On November 22nd, Strong Memorial Hospital had a total of 30 patients on isolation with flu, COVID, or RSV. By December 11th, that number jumped to 61, and we reported 8 more cases this morning. On December 6th, the State Department of Health declared influenza is prevalent in New York State. This requires us to implement more stringent masking requirements for hospital employees, and we encourage all visitors to wear a mask also. People with symptoms of respiratory illness should not visit at all to reduce the chance of spreading infections in the hospital. Strong and Highland are already operating above capacity, so we want to do all we can to reduce the demand for inpatient care. Vaccination and masking inside the hospital are 2 important strategies. Another way people can help us is to manage symptoms of illness before they become severe, by taking advantage of resources outside the hospital. Obviously, if you are having difficulty breathing, have chest pains, or severe symptoms, come to the ED and our teams will see you immediately. If you aren't experiencing a medical emergency, there are faster and more convenient ways to get care. Your primary care provider is always a great resource, especially if you use MyChart, which is a great tool for communicating with your primary care team efficiently. Urgent care is another good option. UR Medicine has many sites across the community, and you can get to our website to see the estimated wait time for each site. On-demand video visits are a third way to meet with a provider, usually in less than 15 minutes, from your smartphone or your computer. This service is available 7 days a week, including holidays, and you don't have to be a UR Medicine patient to take advantage of it. Nobody wants flu, COVID, or RSV to interrupt their enjoyment of the holiday season. On behalf of our incredible team here of healthcare workers at UR Medicine, we appreciate everyone's help to reduce the spread of infection and avoid unnecessary trips to the hospital. Thank you. I'd like to now turn it over to my colleague at RRHS, Dr. Rob Mayo.
Thank you very much. It's great to be here today. I want to thank Dr. Mendoza, my colleagues, Dr. Clark, Dr. Apostolakis, and Ms. Dozier. It's great to share this conversation with all of you, and I want to thank the media as well, and all of the citizens of this great community who come together in times of importance. So as it has been mentioned, the triple respiratory viral season that we're in now is posing some significant challenges for all of us. We have seen a dramatic rise in these infections, as has already been stated, within Rochester Regional Health Hospitals. Within 1 week, we have seen an increase of RSV by 35%. COVID cases have also increased significantly. Midsummer, when COVID was at one of its lowest points in the last 2 years, we had on average about 20 to 25 patients total in our hospitals in the Finger Lakes. Now we're well over 100 patients, and we have several of them on ventilators because of severe respiratory compromise. These illnesses remain very serious, and it is so important that avoiding serious illness be taken first through preventative measures such as vaccination and hand hygiene and mask wearing, as you all know. There's nothing more than any of us want for all of us than to be well and healthy during this holiday season, and wish you well, and hope that your wellness can be ensured by some of the practices that you undertake. We'd like to also remind you that there are many ways to get care, despite the crowding in the emergency departments, which we are experiencing within Rochester Regional Health. Wait times there can be lengthy, notwithstanding that we do all that we can to reduce wait times on a daily and constant basis. So similar to other healthcare resources, Rochester Regional Health has ample urgent care, primary care, and telehealth offerings. So all these avenues of care are great ways for you to get the care you need when you need it, and as efficiently and cost effectively as possible. So many good wishes to you during this holiday season, and thank you very much. And I'll be pleased to turn the time now to Ms. Jackie Dozier.
Thank you, Dr. Mayo, and good afternoon, everyone. Thank you, Dr. Mendoza, and to the rest of the clinical community partners. On behalf of Common Ground Health, you all have the community needs to hear. Everyone has spoken. The rates have gone up. Our community needs to adhere. If you have not gotten your vaccination, please do so. If you need masks or COVID tests, Common Ground Health is here to supply you with those. Also, if you haven't been vaccinated, you need to find out where to get vaccinated. You've heard from Dr. Clark, you've heard from Dr. Mayo, you've heard from Dr. Apolakis and Dr. Mendoza. So please, please get your vaccinations. And more importantly, if you're sick, stay home. Don't assume that there's nothing wrong. Thank you, and happy holidays to everyone.
Thank you, Jackie. In closing, I'd like to also welcome Dr. Renra Dumyati, Director of the Communicable Diseases Surveillance and Prevention Program at the University of Rochester Center for Community Health and Prevention. The center tracks illnesses in our community, and they have been extremely helpful in providing valuable information both to the health department as well as to the rest of the community about the spread of these viruses. And Dr. Dumyati will be also available to help answer any of the data-related questions that you may have. So with that, I will hand things back over to Julie, and happy to take your questions.
Thank you, Dr. Mendoza, and thank you, everyone. We will begin questions on this topic only, and I know some of you are on board to ask questions about another issue right afterwards. If you could hold off on those till we're done with this press conference, we'd appreciate it. Our first question today comes from Spectrum News. Anyone on from Spectrum? You're muted. Okay, we're going to move on to WROC. You have a question and a follow-up.
Well, I'll start out by saying that I think it's important for everybody to work through their primary. To a large extent, things are back to normal, if you will, with regard to how things interact between illnesses and the workplace. So, obviously, if you are sick, please don't go to work. And if you need some verification or a letter, typically we in the primary care community be happy to provide that to you. We just want to encourage people to be paying attention to their symptoms. Don't let things brew too long. Don't hesitate to use MyChart or some other way to reach your primary care practice, and get evaluated as soon as possible, because we can more than happily take care of you, and would rather take care of you before you get to be so ill that you need to be seen in the emergency department.
I'm sorry, is this question for me?
Yes.
Okay. Yeah, sorry. So for RSV, I think we're almost kind of peaking with the number of cases. We had several admissions to the hospital, with most of the admission of interest is in the infants that are less than 1 year old and the 1 to 2 year old. Those are the group of people who get very sick with RSV. The other group that also gets very sick is the older adult who have heart disease or lung disease. So I'm going to re-emphasize the importance of immunization. There is now 2 vaccines for RSV. One is for the pregnant women that they can receive around 32 to 36 weeks during their pregnancy to protect their newborn. And there is also a vaccine that is also recommended in people who have underlying medical condition that put them at high risk of severe disease that are above the age of 60. So for RSV, we're in full swing with a lot of hospitalization of the infants. In flu, we're starting to see cases. Some of them are severe, complicated by pneumonia. We're at the beginning of the flu season, so we haven't really peaked. And for COVID, we definitely have had an increase in Thanksgiving, and it's kind of a steady increase with increasing hospitalization. So we have vaccine for both as well, and I urge everyone to get vaccinated to prevent you from getting severe disease. Thanks, Isabel, and everyone. We did, you will get an email with a link to the data as well as some charts that has been sent to your news organizations. So you will have some of this data mapped out for you. Our next question comes from Jennifer Lukey.
Hi, everyone. Thank you for your time this afternoon. I'm sort of living this right now with 2 small children. It just keeps going from one to the next. And when I brought them to the pediatrician, they didn't do any testing for it. They just figured it's something viral that's going around. Dr. Mendoza, is that the approach you want them to take? Should parents insist on a test? Does it change the course of treatment? And is it affecting children more than adults, or is it sort of a big spectrum?
Well, as with most good questions, the answer is it depends. I would encourage everybody to go to their healthcare provider, and your family physician or pediatrician is well trained in evaluating symptoms, looking at things like history, how long the symptoms have been present, how severe they are, looking at your medical history, looking at your vaccination status. And we pull all those data together, and we'll come to an assessment along with our physical exam to determine if you need a test of some kind. I saw 3 patients this morning that came in and said that they had already taken COVID tests at home. So that was helpful for me to know, because it was much less likely for them to have COVID today. So these are all the kinds of things that we take into account. There isn't a a one size fits all for these kinds of illnesses, and nor should there be. So what I would encourage everybody to do is have that conversation with your primary care provider, and they'll take good care of you.
Okay, and my follow-up is for Dr. Apostolakis and Dr. Mayo. Of course, I can't leave you guys out. I'm wondering, you say we're sort of at the brim, we are overloaded at the hospitals again. Where does this sort of stack up in comparison to these surges in the past? And have you had to surge space? Have you had to make any alterations or adjustments to how you give care in the emergency rooms because you are overloaded?
Thank you for the question, Jennifer. Yeah, as you state, we are frequently in the 105 to 110% capacity. And I can't say enough about our faculty and staff who continue to work and take care of the patients we see. The one advantage of being a system is being able to load balance patients across the system. And what we're doing is working with our patients and their families. And at times when things become more critical, and if it's appropriate for the patient, we ask them if we can safely transport them to one of our affiliate hospitals where they can get the same care from the same UR medicine providers and excellent nursing staff. And so we've been doing more load balancing throughout in order to make more space. We are also very creative in using spaces in the hospital that can accommodate patients, on a 24/7 basis. So we do have other space in certain areas that we're able to surge into when needed. But as you state, the space is limited. And so we want to make sure we take the very best care of all of our patients. And so we explore a number of options as things get busier.
Yeah, thank you, Dr. Apostolakis. And Jennifer, great question. It's an important thing for the community to appreciate what great healthcare resources we have here in Rochester, but they aren't limitless, right? And we need to all be partners in how we utilize them and utilize them wisely. Fortunately, the good news is that the current surge of the combined respiratory illnesses is not comparable to the big surges during the COVID pandemic. It's much less than that. And that's a good thing for sure. We don't really ever want to visit those days again. But our ongoing need to manage our resources is a daily matter of importance. And our emergency rooms some days have very few patients waiting for admission. And other days they're very overloaded, where there could be 50 plus, 70 plus patients waiting for an inpatient bed. And that's not ideal. It's not good for patients to be in hallways or families to be waiting in hallways with their loved ones. So the less pressure on our EDs and our hospitals and our health systems, the better. But having said that, we're all in, right? We're here. Our employees are highly committed, as all of I know that's true of all of our healthcare employees across our community, and they go the extra mile every day to care for patients and to not only address their medical needs, but to comfort them emotionally and to comfort their families. And so we do want people to get the care they need, but in the right location. So seeking out the urgent cares, the my care or my chart options through the electronic medical records, and telehealth is a really great option for us.
Thank you very much, Dr. Mayo. Our next question comes from 13 WHAM.
Good afternoon. This is Chris Lopez, 13 WHAM News. Thank you for your time. My question would be, what are the rise in respiratory cases for this year looking like in comparison to last year's rise in respiratory cases? And then the follow-up would be, is there a reason that that's been pinpointed, either for a rise or for a fall?
So I'll start first, and perhaps Dr. Dimyati can weigh in, or others. But the first thing I'll say is that if there's anything I've learned about respiratory virus season, it's that you really can't compare one year to the next. Every year will be different, though there are some patterns. And so we are entering the predictable pattern of influenza beginning late November, early December. Things tend to peak in December. Late December, early January. Typically, we see, influenza A first, then influenza B. This year, it looks to be a little different. We're seeing more cases of influenza B earlier in the season, so that's something that we're going to follow. With COVID, every year is a little bit different. We have seen, a pretty substantial rise, particularly since Thanksgiving, in the hospitalization. So that tells us that severe illness is very much possible, especially among those who have other medical conditions. And when it comes to RSV, as Dr. Dimyati says, we're almost at the peak for that. We'd certainly like to see that come down as quickly as we can. But particularly among those who are under 2 years of age, or those who are 60 and older with especially lung disease, we want to make sure that they stay out of the hospital. So we're seeing a relatively typical pattern when it comes to RSV. I think the bottom line message here is that it's not too late to get vaccinated. It takes roughly 2 weeks from when you get your flu shot to have the full protection from that flu shot. So we are well ahead, very much not yet at the peak for influenza. So now is a great time to get your flu shot. And the same can be said for COVID vaccine as well.
Thank you, Dr. Mendoza.
Dr. Dimyati, do you have anything to add?
Yeah, I can just say, can I just say maybe let people know about the ROC Health data, where you could follow the number of flu and RSV cases, and the number of hospitalization, and the age breakdown, and the number of deaths. I think for RSV, as I said, we're starting to see a big increase, so we're peaking. And usually we peak, and then in the next few weeks, we'll see a decrease. For flu, we're just starting, so this is the beginning. And it's very hard to predict each year if we're going to have a big spike or it's going to be steady, slow increase. At this point, we don't know. We're bracing for the worst. So this is really a very good time to go and get vaccinated because we're just starting the season. And for COVID, it has been, it varies and it's steady. And all that data is on rockhealth.org. rockhealthdata.org, and Dr. Mendoza put the link in there. There's data from last year and this year, and it's updated weekly.
There is a link to that in the press release, as well as at monroecounty.gov/health. All right, our next question is from the USA Today Network. I believe Emily is on.
I'm all set, thank you.
Okay, and then WXXI, do you have a question?
I have a quick one. Thanks, Julie. For, I guess, Dr. Mendoza or anybody else, if it's appropriate, our Capitol Bureau Chief, Karen DeWitt, yesterday asked the State Health Commissioner about these very illnesses. And in terms of the new COVID booster, I think he said something like only about, or fewer than 10% of all New Yorkers have received the latest booster shot. Dr. Mendoza, do you have any data offhand on what percentage of folks in Monroe County have received it? And if the numbers are comparable to that, is that, one thing that will really kind of impact how many more of these, severe COVID cases that we see?
Thanks, Randy. I'm not sure if those data are available yet on rockhealthdata.org. Dr. Dimyati, do we have the COVID vaccine booster data on there yet?
No, we don't.
Yeah, it takes a while to get those data. So last year, for what that's worth, only about 50% of our community availed themselves of the then current COVID booster. I think most of us anticipate that the number this year will be less than that, which is unfortunately, in my view, a missed opportunity. The vaccine has been proven to be safe. It doesn't prevent all cases. We know that. It does not necessarily prevent infections. We know that, but it has been shown through very rigorous science to minimize the likelihood of severe illness, and that's really what we want to protect people from severe illness, so that they don't themselves find their way to a hospital, as well as so that we can preserve our hospital resources for all of the other things that people may find themselves experiencing and need hospital level or emergency department level care. So it is true that it's very likely that the number of people in our community who have gotten the COVID vaccine to date are quite low. And that's the reason we're meeting today. We really want to encourage everybody to get that vaccine as soon as possible.
Thank you.